Cancerous changes are never painful. They are always painless lumps, painless changes, and that is the reason the female usually don't go to a doctor as of first go. So ma'am, please correct me if I'm wrong. I have heard this from pregnant women who are in their lactation period कि कोई lumps form होते हैं. So how women who are newborn new mummies, how they can identify कि is it something different or सिर्फ normal routine वाली चीजें हो रही हैं उनके साथ? And smoking and alcohol, so which is like very common, like as in teenagers now. I can see the school going children also are having, they are going through all these things. Hello everyone and welcome back to our YouTube channel, The Voice of Woman, a podcast dedicated to empowering women through education, conversations and even shared experiences. I am your host Diya Singh and today we are diving into a topic that touches the lives of many women and their families, which is breast cancer. Now with us today we have Dr. Neha Yadav, a general physician and a diabetologist with extensive experience in women's health. Now she also holds an MBBS, MD and CTCs, and today she'll help us better understand the signs of breast cancer, its prevention and treatment even. Now welcome ma'am. We are excited to have this one-on-one conversation with you. Alright, so with this, I guess we should quickly start with the session. So I guess we should start with the very basic question first. The first question, early signs and symptoms of breast cancer. क्योंकि I feel लोग ये understand ही नहीं कर पाते हैं कि इनके signatures क्या हैं, कैसे start होती हैं चीजें. See, the breast cancer nowadays, it is being very common. Right. And cancer itself has been came up to the top 5 reason of the death in India. Wow. So which is really not a good sign. But as this October month is also a breast cancer awareness month, so this is a very good topic as of now. Basically early signs of breast cancer is any lump or any change or any abnormality in the breast of a female, and it is always painless. So any painless lump is 90% indicated as breast cancer. And there are many initial signs and symptoms of the breast cancer, like as any abnormality in the shape and size of the breast, any changes in the skin, like as any redness or the puckering of the skin. Puckering of the skin means like as orange peel skin. We call this as pewdy orange skin. Like the skin of the orange is there, so it is some dimpling there on the skin. So the same sort of skin if a female is having in the breast, that is also a sign of the breast cancer. And any abnormality in the shape and any discharge from the nipple. It can be bloody discharge, it can be transparent discharge, any sort of discharge which is coming abnormally from the nipples. They are also the signs of the breast cancer. So for the early detection, I run many centers. I go there and I teach students and I teach females how to just do a self-examination, which is very important for early detection. Right. And every female should know about what are the steps and how do we do it, and how can we prevent early breast cancer. So these are the major signs we should know about it. Right. Alright, so we discussed about कि क्या-क्या signs and symptoms हो सकते हैं early stage पे और कैसे identify कर सकते हैं that there are chances of you being a victim of breast cancer. Now I guess हमें ये जानना चाहिए अब इस question से relevant कि क्या techniques है जिससे औरतें खुद को examine करके they can identify कि क्या. See, basically the examination of the breast includes 2 steps. One step is the observation and the second step is palpation. So the observation is just the female herself has to see how the changes are there in the breast or not. The best time what I can say is for the breast examination is from 5th day of cycle to you can just before the 2nd cycle. And if the female is pregnant or menopausal, and then they should fix a time in a month where they have to examine their breast on the same date, so that they can know the changes in their breast at the same time of the month. So, and once in a month examination is mandatory. You should get it done, not every day, not once in a week. So once in a month is sufficient enough. So the best time of examination of the breast is when the female is going for a bath. So she should stand in front of the mirror and she should look to her breast without when they remove of the clothes, they should see their breasts. Firstly, putting their hands aside, both the size of the breast is equal. Is there any disparity in the size of the breast? Any changes in the color or the skin or any abnormality which they can see? Secondly, they should put their hands up. And in that case, if there is some hidden lump which comes out after seeing, so they should do it after they putting their hands up. And the thirdly, they should put their hands on their waist and they should clench their skin like this, and they should see if there are any changes at that position, then they should be aware of. Then second part of the breast examination is palpation. Palpation is, we do palpation with these 3 fingers, and it has to be done from the right hand. You examine the left breast, and from the left hand you examine the right breast. So you have the examination technique is, you just put your finger on your breast and you should rotate like this. So this is the best way you should examine the breast. So the female should stand straight and she should examine her breast in this motion like this. 1, 2, 3, 4, from top to bottom. So samely from this hand, they should go in a parallel manner. They should examine their breast. And secondly, they should also examine the underarm area. So the underarm area, they should dip with these fingers and they should go in the deep if there is any abnormal lump or any abnormality is there on the axilla area. Same with the other hand, they should examine like this from the tips of the hand. If anything they can feel which is not normal and which is non-symmetrical from both the breast. So they should do that. Secondly, once they have done the examination while standing up, they should lie down on a straight bed surface or any surface. And while lying down, they should again examine, because after the lying down, the breast muscles are being relaxed. So they can examine the same pattern from down to up. So they should go like this from these 3 fingers. Similarly, from the left hand to the right, and they should go like this, the examination. And similarly, they should put their hand up and they should examine their axillary area from the left hand to right hand and right hand to
always in the opposite
hand.
direction.
Yes. Right. So that is a better way of examining. And if you find anything abnormal, if you find any which is not symmetrical in both the breast, you should immediately go to the physician or any gynae or a cancer specialist just to reconfirm with them, and they should be investigated as early as possible, because if we can detect the breast cancer in an early stage, it can be cured completely.
Okay. All right. Ma'am, are there any changes in the physical appearance as well? I mean, it is not mandatory for everybody. I mean, not every day we can, do the practices as mentioned by you. So, any changes in the physical appearance of the body? I mean, internally, if there are any possibilities कि कुछ abnormal चीजें लग रही हैं which you need to observe?
So, only the breast cancer sign is any abnormal lump, skin changes as I already told you, and any discharge from the nipple. So these are the 3
biggest
major
red flags.
Red flags you should go through, and you should be aware of if there is something or any abnormality in the symmetry of the breast. So you should take care of that thing.
All right. So with this, we are moving to a quite technical question. I mean, medically technical term, which is mammograms. What is it, and at what stage we should start getting it done?
So mammogram is a screening test for breast cancers. It is basically an X-ray of the breast. So the ideal time to get a mammogram is a female who has crossed 40 or she's 40. She should be 40 or she's above 40. So she should get a mammogram done annually, once in a year, which has been recommended in the general health checkup in our recommendation. But I don't know, in Indian population, the female don't do that.
People are not even aware about that they are supposed to do this.
Yes.
So ma'am, please correct me if I'm wrong. I have heard this from pregnant women who are, in their lactation period, कि कोई lumps form होते हैं. So how women who are, newborn, new mummies, how they can identify कि is it something different or सिर्फ normal routine वाली चीजें हो रही हैं उनके साथ?
See, during the lactation period, formation of the lump in the breast is very, very common. if the females are lactating and they are not able to feed their child for a long duration, so that is the engorgement in the breast, which is not at all cancerous. In that case, those lumps and those engorgement of the breast is painful.
Right.
So as I've already told, the cancerous changes are never painful. They are always painless lumps, painless changes, and that is the reason the female usually don't go to a doctor as of first go, because they are waiting कि pain नहीं हो रहा है और हमें क्या करना है, तो they just hide up and they just land it up into a bigger picture.
This I feel is a
the
typical
stage.
housewife behavior of every Indian woman out there.
They don't do. But in the case of the lactating female, so it is always painful. The female will feel the pain in the breast and engorgement and redness, and that lump is always painful. So that is because of the engorgement of the breast milk, which has been engorged in the breast, and this is different. So they have a differentiating features.
All right. Now coming on to a very important question, which is how to prevent breast cancer and कितने stages होते हैं and at what stage people can identify and at what stage it is curable.
See, preventing the breast cancer, there are many factors which may cause breast cancer. Some are changeable, that we can modify them, but some are not. So nowadays, the major issue with the females are they are getting married late, or they are getting the childbearing is very very late. Most of the females are getting their child at the age of 30, 40. I can see in my OPD many of the females, those who have turned 40 and they are just conceiving for the first time, and they are planning the baby there for the first time. So which is also not good. I know that female should focus on their career, which is very good. I myself as a working female, I always appreciate. But apart from that, they should also know that the fact that nature is nature.
Right.
So the child bearing age should be ideally before 30. The first child should be before 30. So what happens during the pregnancy, your breast changes, which is being done, duration of the cycles is being stopped for 9 months. So every month when the breasts are being engorged during the cycles, before the cycle in the PMS period, and during the cycles they release the hormones and the breast becomes softer.
Right.
So these cyclical changes stop for 9 months. Okay. So this also prevents of getting the cellular change in the breast, and finally in a long run will prevent the breast cancer. So this we can prevent. Thirdly, secondly we can prevent the breast cancer by early detection, as I have told you, the self breast examination.
Right.
Secondly, your lifestyle. So lifestyle is the stress. Nowadays everybody is working, everybody is stressed, everybody is doing extra work. तो स्ट्रेस अपनी लाइफ में आप जितना कम करोगे, सो दिस विल हेल्प यू इन रिड्यूसिंग द stress level in your body and the changes which is there, which may end up into these cancerous changes. Then the next is your eating habits. So you should not eat too much of junk. Junk means don't take it as सिर्फ पिज़्ज़ा बर्गर ही जंक होता है. So it's about what we eat in a daily basis. You should eat what is available in that season. So seasonal fruits and vegetables, because nowadays all fruits and all vegetables are available throughout the year.
Right.
All over the world you can get everything any time of the year. So you should focus on the seasonal things which is freshly available. So you should take those things. Then comes your physical activity, how active you are. So nowadays everybody is over the phone, over the laptop, over some screen time is too much, and they are doing night shifts and they are not sleeping properly. So all these sedentary habits also just reduces your stamina, reduces your metabolic rate, and this all changes on a chronic and a long run will end up into some abnormal changes, which may end up into some cancerous changes.
Right.
And smoking and alcohol. So which is like very very common, like as in teenagers now, I can see the school going children also are having, they are going through all these things. So we should come out of all this, and they should be aware of what are the consequences of these habits which they are just going at the age of 15, 17, so which is not good for a long run. So these are those changes which you can modify and will help you in preventing you from cancer. There are some changes which you cannot change, like as the females, those who are, they reach their menarche is when a female got first time their cycles. कुछ फीमेल्स को जल्दी साइकिल शुरू हो जाती हैं और लेट तक रहती हैं, तो वो हमारे हाथ में नहीं है.
True.
दूसरा, एजिंग ऑफ द फीमेल. जैसे जैसे एज बढ़ती है, द चांसेस ऑफ गेटिंग चेंजेस इन द ब्रेस्ट एंड गेटिंग इन कैंसरस चेंजेस इन द ब्रेस्ट, और देर आर मेनी अदर्स कैंसर्स इन द बॉडी ऑल्सो. सो दैट इज ऑल्सो मोर प्रोन, जो हमारे हाथ में नहीं है. वी कैन नॉट चेंज दैट थिंग.
राइट मैम, मैं एक यहाँ कॉन्ट्राडिक्टरी पॉइंट बोलने वाली हूँ हिना खान का.
क्या?
That she has a healthy lifestyle, of course. She is a gym addict, a good body, a good physique and everything, but still she got breast cancer.
So as I told you, these physical activities also a matter, but apart from there are many other factors also which may cause and end up into some cancerous changes. We don't know her family history.
Right.
We don't know her genetic changes. We don't know any other personal life, what all.
Right.
She's not having kids and all these things.
Right,
we don't
right.
know those changes. So we cannot comment कि these are the only factors कि अगर आप जिम जा रहे हो, अपने आप को maintain कर रहे हो, so you won't have cancer. There are many n number of factors.
Factors, true.
Yes. So we don't know what is the factor which end up into this in her case.
Right. All right, everybody. So that brings us to the end of this video, and this was quite an insightful video wherein I really liked the chit chat, ma'am. It was very informative and very enlightening as well. I hope you also enjoyed this.
Yes. It was really nice to talk to you.
Alright, so if you really like the conversation we had and you want to meet ma'am in person and you want to get things done from her, you can definitely reach out to her. Ma'am ka clinic is in Nitikhan 2, Indirapuram, Ghaziabad, and obviously her name is Neha Yadav, so you can directly get in touch with her, and you can also find her on Google, of course. So if you want to get your things done from her, definitely do give her a visit, and because she's a very cute doctor, as you can see. Alright, everybody, make sure that you have liked this video, and अगर आपको ये वीडियो अच्छी लगी हो, do comment and let us know कि आपके क्या queries हैं. We will have a look at the comments. So we'll try to reply to all the comments and we'll clear out all your queries, as many as we can. And make sure that you have subscribed to our YouTube channel as well.